Bismillahirrahmanirrahim. So there is a confusion regarding some MCQs, that is about the inner ear, that is during rotation of the head toward the right side, which semicircular canal is stimulated, right or the left? The answer is simple, right semicircular canal is stimulated. Well, the next question is, a person is spinning toward the right side. During spinning, which semicircular canal is stimulated? So no semicircular canal is stimulated during the spinning toward the right. At the start of spinning toward the right, it is the right semicircular canal that is stimulated. After gaining the equilibrium, which semicircular canal is stimulated? No semicircular canal is stimulated. At the end of spinning sensation, it is the contralateral, that is the semicircular canal opposite to the motion. Suppose person move toward the right side, at the end of spinning sensation, this is the left semicircular canal that is stimulated. Another MCQ is, a person is spinning and he suddenly stops spinning toward the right side. At the end of the spinning rotation, which semicircular canal is stimulated? Left one. Now we will explain the concept. Of course, everybody has two ears, and of course in each ear there are three semicircular canal. We are having the, suppose this is superior semicircular canal, this is horizontal semicircular canal, and this is posterior semicircular canal. You have to keep this in mind. Posterior semicircular canal, superior semicircular canal, and the horizontal semicircular canal. This superior semicircular canal control movement like this. Yes motion. So it control movement like this. This horizontal, it control movement like no motion. It is stimulated no in no. While this posterior, it is stimulated in tilting of the head toward the shoulder. Now let's take the horizontal semicircular canal. We know that in semicircular canal there is fluid called endolymph. And what happens when I rotate my head toward the right side? The fluid inside the canal, they remain at the same area due to inertia, but the canal moves. When the canal moves, so what happens when the canal moves? So the right side is, when canal moves toward the right, when both the canal moves toward the right, fluid remain intact. So what happens? It causes the stimulation of that capula, and right side air is stimulated, and there is decreased firing of the left side air. During rotation of it toward the right side, what happens? The canal moves. So the canal moves, but the fluid remain at the same place. When the fluid remain at the same place, so what happens? The canal moves, so it actually stimulates those narrow endings. So during rotation toward the right side, right is stimulated. During rotation toward the right side, which one is inhibited? Left side. At the end of spinning rotation, what happens? You suddenly stop. When you suddenly stop, the ducts, they stop. When they stop, what happens? Now the fluid take reverse direction. When the fluid take reverse direction, now the left side is stimulated. And the right side is inhibited. The left side is stimulated and the right side is inhibited. So there is increased firing from the left side and decreased firing from the right side. Now we have to understand the anatomy of this. In order to understand the anatomy, we have to keep that in mind in order to understand this. So this is, now let's suppose take both the semicircular canals. So let's suppose this is the right semicircular canal and this is the left semicircular canal, and this is the fluid, endolymph fluid, and this is the area from which the nanofibers arise, in which this area is stimulated. We perceive the motion. We perceive that we are moving. Now if a person moves toward the right, what happens? The inertia of the fluid is more as compared to the inertia of the tubing. So the fluid, they remain at the same area for a little time, and the duct moves. Both the duct moves. If both the duct moves, so what happens? This side, it comes toward the stimulatory area, and this side is stimulated. This is at the start of spinning sensation. What happens at the start of spinning sensation? Both the fluid remain at the same area. It is the duct system which moves toward the right, both the ducts. So if both the duct system moves toward the right, the left fluid it moves away from the stimulatory area, while the right fluid it comes to close to the stimulatory area, and it causes movement of the cynosuria. It causes movement of the cilia, so it is stimulated. Now what happens after some time? The speed of the fluid and the speed of the duct, they remain the same. So after some time, no duct is stimulated. Neither the right semicircular canal is stimulated, nor the left semicircular canal is stimulated. This is a very deep concept. During the start, if you are moving toward the right is stimulated. If you are moving toward the left side is stimulated. After some time of spinning sensation, neither the right nor the left is stimulating. There is no stimulation of either the right semicircular canal or the left semicircular canal, because the inertia of the fluid and that of the duct now remain the same. So there is no movement of the cilia. At the end of movement, what happens? The tube remain the same, but the fluid is still moving. So what happened now? This moves away. This moves away from the stimulatory area, but this type of fluid comes toward the stimulatory area. So at the end of spinning sensation, the contralateral side is stimulated. So it is the left side. Thank you.